next session is on leveraging technology to deliver value to patients, caregivers, and providers. Mr. Vinodkrishna Poyyale, Director Value at Roche. Mr. Poyyale has got over 19 years of experience in IT and pharma industry, who has climbed the value chain from IT sales to become the Director Value at Roche, the world's second largest pharma company. Hereby invite a passionate healthcare professional who is a farmer by heart, Mr. Poyyale.
I work as a value director in Roche, which is a new title you may not be familiar with. I'm here to talk about leveraging technology to create value in healthcare. In the due course, I'll try to give you some of our experience that may be of use to you. Before I get into the main topic, let me start with a story. This is a story of a patient, let's call her Vijaya. She presented as a 32-year-old wife of a factory worker and was diagnosed with a particularly aggressive form of breast cancer. Well, the doctor told her that there is a treatment, but of course, being the wife of a factory worker, she didn't have the means to get herself treated. Now, this is not an uncommon situation that a physician faces in his practice. On a daily basis, there are these patients that physicians have to face. This patient, Vijaya, had a single plea. Can you let me live for another 3 years so that I can see my 2-year-old daughter go to school? Now, in the case of Vijaya, there was a twist in the story. The company representative got to know about her plight, took the pains to finally figure out that she has employee state insurance coverage and she can get herself treated. Later on, realized that her shoe company had defaulted on the premium, because of which she may not get treated. Then convinced the owner of the shoe company to clear the dues in 1 day time. Finally got her the treatment that she deserved. And she lives a happy life. Today, 2019, she lives happily with her 10-year-old daughter. Now, this is a very unique incident. Not everybody is as lucky as Vijaya. The bottom 40 to 50% of Indians have some form of government insurance coverage or the other. With Ayushman coming in, there is ESI which covers 10% of India's population. But then a lot of those patients are not aware that they have this coverage or how to avail it. There's another large chunk of middle class who do not have any kind of insurance coverage, and they do not know where to get quality healthcare within the budgets that's available to them. And like Mr. Jalan spoke earlier, by the time they get to the right physician, to the right hospital, they would have already exhausted their money. They wouldn't have been poor to start with, but by the time they get the right treatment, they're already poor. Now, if we have to create value in healthcare, it must be for these patients. Now, we do know that technology has revolutionized many other sectors. Healthcare has been a laggard in this case. Here, the question at hand is, what would it take for healthcare to leverage technology to deliver value to these patients? Now, in my view, the first step has to be leadership buy-in. The leadership has to believe that technology can revolutionize healthcare. It must set up a vision for digital transformation, must treat data as a strategic asset. But not only that, it has to be treated as an asset that everybody can use to create new value proposition for patients, caregivers, and the exchequer. And of course, technology has to be one of the strategic levers that has to be called upon for creating any kind of new value proposition to patients. And it is with all of these thoughts that at Roche India last year, we thought of remodeling our operations in India. We started with a 2030 vision, We took the year 2030 essentially from the point of view that India's healthcare access challenges cannot be properly dealt with a 3-year plan or a 5-year plan. You need a long enough window for you to start acting on some of these problems. So this is our vision. Our vision is to inspire people to transform healthcare and care for every patient's life through sustainable, innovative solutions. What we mean to say by this is that we understand that as a small organization in India with just 300 people, we may not be able to do it ourselves, but we will join hands with anybody who has a similar outlook to try and transform healthcare. Would not narrow our focus into those indications or therapies that we are necessarily present in, because what India requires is a health system intervention, and India's solutions need to be evolved in India, but probably the rest of the world can benefit out of it. We, of course, have technology as one of the key levers through which we intend to provide broader healthcare access, as well as access to Roche innovations. Now, this is all good. We also know that for sustainable digital strategy, I'm not talking about ad hoc, one application here, one application there. For a sustainable digital strategy, it has to get evolved through continuous ideation, decentralized decision making, and rapid piloting. And there needs to be a thorough implementation of key processes, continuous upskilling of your workforce. At the same time, we need to see whether this is all realizing value. If not, go back to the drawing board, continue your ideation, continue your piloting. Rapid piloting and scale up. Now, the first thing that we did for evolving ourselves for an evolutionary mutation is to do a digital maturity assessment. I'll talk about the result in a moment. Followed that with a process for continuous upskilling. So we now have a community of cross-functional team members called the capability community, who on a regular basis looks at what are the emerging capability needs that are in line with our strategic priority to essentially set up a learning culture in the organization. Now, talking about culture, the bedrock of this transformation has been culture itself, where we have rebranded failure as learning. And today, the reward and recognition of Roche India reflects this. We reward people for learning that they have been able to bring out of a pilot, rather than looking at whether the pilot was successful or not. So this was followed up by cultural norms that would celebrate diversity. Today, we do not have functional identities in the organization. We identify ourselves by whether we are a state-based team member who's in the field or one of the cross-functional communities. Functional structure for us essentially only represents capability building. You need to be part of a medical team to upskill yourself. You need to be part of a finance team to upskill yourself. Otherwise, your allegiance is to a state team or a community or cross-functional project team. Finally, we do not have marketing plans anymore. We only have lifesaver plans. Because here, we believe that being in healthcare industry, this is a responsibility and not a job. Finally, what does structure stand for? Like I said, it stands for capability building. We have a role for digital transformation officer. There's a cross-functional team again called technology community. So that technology is not part of a sub-function or a function. It is everybody's responsibility. We have democratized data. I'll talk about it in a few minutes. And then finally, all of this is aided by full empowerment for decentralized decision making. Now, this being said, our initial digital maturity assessment result came out as thus. In 2018 beginning, we were in the middle of the adopter band when it came to digital adoption. where we had a plan for digital transformation and we were in the process of executing it. That being said, for any transformation, it's important that the team buys into it. Otherwise, the transformation will never be completed. In 2017, our engagement score was abysmal. We had a 46% employee engagement score. For those of you who are familiar with this is beyond abysmal. But that being said, post-transformation in 2018, the employee engagement rose to 78%. And as it stands today, just a few days ago, we were certified as a great place to work. Now, once the team rallies behind you, what you require is a process for continuous innovation and evolution. We took inspiration from services industry. Normally, we don't do that. I mean, in healthcare, we have a strong belief that we cannot operate like any other industry. We have to have all the solutions which are traditionally there, and we will only leverage that. So there's a very well-established framework called service blueprinting. We have looked at it and took inspiration from it and created a healthcare service blueprint where the patient journey is mapped, and this is digitized in a framework so that we can analyze the data and come out with robust insights for innovation. So starting with symptoms to adherence and support for the patient. We then mapped all of the different stakeholders, from patients themselves to policymakers to primary healthcare physicians to hospitals and diagnostic centers, and who from our team are interacting with these stakeholders so that we can deliver value to patients. Now, these interactions are what we call as moments of truth. These are interactions where your value proposition for patients are either rejected or accepted warmly by the stakeholders. These are also opportunities whereby we can deliver the most ideal patient experience, customer experience, and employee experience. Now, what do I mean by these experiences? Essentially, these are driven by 3 questions. The first question from the point of view of patient: is this treatment easy enough for me to adhere to? If it is not, if I have to travel too much, if it is not accessible enough for me, I'm not getting the right experience and I can fall off treatment. Second, for the physician, would this treatment take me 1 hour to counsel the patient? If it's going to take me 1 hour to counsel for the patient, or if I have to fight with the pharmacy to get the product available in the pharmacy, I am first of all discounting time from other patients. Typically in India, it will be a lucky day if a physician is able to spend more than 10 minutes with you. Hence, this treatment is never going to be used as often or as effectively as it should be used. Finally, employee experience. If these value propositions and strategies are going to be difficult for the employees to execute, they're not going to stay put. And both for the customers and for the employees, it's important that they get gratification. The initial patients who come in has to be selected properly so that there is a positive feedback, because of which a treatment gets popular. Now, these value proposition needs to be hence supported by expert communities who will ensure that employee experience at the field level, and of course enabling processes which are currently either digitized or in the process of getting digitized. We use balanced scorecard system, which is a most widely used strategy implementation system in the world, to essentially convert all of the initiatives of the organization into projects. And these projects and the status can be viewed by all employees in equal measure, so that essentially there is no secret to the strategy. Everybody understands the strategy and can execute it properly. Now, there are few first steps that we've been able to take. The journey has been short. From an employee experience perspective, we have come out with a singular app. Normally in large organizations like ours, you will have multiple different data systems and essentially data silo. We've created an app, I'll talk about it a little bit later, which subsumes all of the data systems in the organization. Second, there's an AI-assisted patient navigation application, which essentially lends for financial counseling, and a smart EMR and an AI-enabled virtual tumor board. Now, first, let me talk about the application that we've built. Essentially, this is an application that subsumes all of the other data systems that we have. It's about democratizing data. If the data resides with only a few experts in the organization, you will never have rapid innovation. So it's important every employee, regardless of the title, role, etc., has equal availability of data. Secondly, the other feature of this application also is a query management system. In the organization, whether it's a field employee or any other employee in the organization, if he has any hurdle that he's facing because of which he's not able to render the service effectively, he can just raise it in the query management system. It treats the query just like a service request that you and me would raise with our service provider. And this then will enable us to improve our turnaround times and agility. So this application is for patients like Vijaya that I spoke about. If a patient calls into a Blue Tree call center, gives some basic background information, a call center agent will run that as a search in the application, and this application is backed up by artificial intelligence, which updates more than 120 plus government schemes in the country to see which of these schemes might the patient be eligible for, and then guides the patient in order that they are able to access the scheme. So far in the pilot phase, we've been able to help more than 40 patients with this who would have otherwise not got treated. We expect to soon scale it up so that it's available for more patients. Finally, this is about shaping the EMR ecosystem. We know that the EMR adoption in the country is less than 10%. And even that, if you talk about the 7 different levels of EMR, we hardly may have any EMR which is at the highest level of utility. This is our endeavor. We've partnered with a healthcare IT startup, which is actually based out of Hyderabad, called HealthPlix. Essentially, it reduces the time that physician needs to spend on the system. We did a time in motion study in a big oncology setup, government setup, and we found that 60% of the physician's time is spent in administrative work, and they spend lesser time with the patient. This is our endeavor to see how we can facilitate more time with the patients. And finally, this is the last penultimate slide. This is a future product which is coming in. It's a clinical flow application. This is an AI-based application that speaks to different data systems in the hospital, curates the most difficult cases that needs a multi-speciality discussion. And then once a decision is taken on that kind of patient, it ensures that that treatment protocol is implemented across all the patients who have similar kind of condition. Now, this being said, like I said, we know that we cannot make a significant difference in the healthcare ecosystem alone. This is a partnership model. We have vision partners, partners who share our similar kind of vision and has a long-term view. And we'll have delivery partners who are essentially project-to-project based partners who have shared value. And we intend to collaborate for broadly these 3 areas, either to increase the treatment pool or to improve patient outcome and patient experience, and finally in improving efficiency in the way that we treat patients. This is our journey so far, and this is the end of my presentation. Our endeavor is doing now what patients need next. Thank you.
Any questions from the audience?
Wonderful presentation. One quick question is, are there initiatives around increasing the reach? I mean, when I say increasing the reach, how do you, as Roche, create awareness that something of, what you spoke about, the Blue program exists actually, and, how do more and more patients reach it? because the challenges are, people are not aware, they are not able to reach. So how do you propose to solve that problem across?
See, again, through partnerships. There are, what we've realized is there are a lot of different stakeholders who are trying to solve the same problem. But the issue is that we are all doing it, trying to do it alone. So we have entered into MOU with a few NGOs, large NGOs, who are in the same field, and we essentially become the domain expert. There are certain domain expertise resources that we bring to the table, and we intend to create programs to improve awareness, and not just focused on tertiary care, but essentially at the health system level. So one of the examples is our MOU with Tata Trust. Because Tata Trust has a very big vision for improving cancer care access in the country. So we have signed up with them. So that's one of the examples that I can share.
Thanks.
Any other question?
I'm very impressed looking at. I personally struggled through a lot of things doing similar thing and failed, and you succeeded here. That's compliment to you. My question is on the alignment of your team, value team, with the conventional sales and marketing team. How you get embedded with, though you have explained it, but my experience is most of the time people ask, what is the ROI? When ROI will come from this team or this initiative? The typical sales and marketing team asks how to manage that.
So excellent question. We do not have sales and marketing team anymore in Roche. No one in the organization has a revenue target. We only have patient impact measures. So essentially, everyone in the organization has a patient impact measure, both in terms of how many new patients could they bring into the treatment pool, and also how many patients could get access to Roche innovation. I hope that answers your question.
Yeah, but whether the stakeholders, shareholders, how they see the value?
Yeah, so we believe that revenue is it's an enabler for creating a change in the society. So I'd encourage you to read an article that was written by Michael Porter in 2011 in HBR, Harvard Business Review, about corporate social value. So it's an evolution from corporate social responsibility, where you share some bit of your profit back to the society, into remodeling your basic operations, so that as you grow as a business enterprise, the community around you grows as well. One thing that really helped us for Roche India is our Vice Chairman, Andre Hoffman, the Roche Chairman. He endorses this view, and he is already on the path to creating a similar. That's why I said leadership buy-in has to be the first thing that happens.
Thank you very much.
Hi.
EMR or a real-time clinical decision support system.
Okay.
What it is, and it's a virtual tumor board. So if you know how tumor boards operate in the hospital, whenever there is a really complicated case which one specialist cannot solve, that you need an oncosurgeon, you need, let's say, a gastrosurgeon, and gastroenterologist, and then a medical oncologist, etc., to come together to discuss. They manually do this, bring it once in a month to this meeting, and then they take decision. The problem is, because it's highly manual, it's difficult to identify these cases. Secondly, if a similar case comes tomorrow, what do you do? Do you have an assurance that that patient will also get the same kind of intervention? Did this intervention work? And so on and so forth. So this essentially ensures that it speaks to the EMR of the hospital, it speaks to different, the PACT system, the other systems in the hospital, and then curates the cases automatically and then follows through. And
So does it have any algorithmic implementation? Like, can it say whether a tumor is malignant or non-malignant?
No, it picks up already diagnosed cancers. There is another system which is, essentially you need other diagnostic systems which are in development as well by multiple organizations. This is an AI-backed system, which is a clinical workflow application. So it does not help you detect new things.
Right. Thank you so much.
That will be the last question. Sir is available. We have tea session as well, so you can interact with him. So, ma'am, go ahead with your question.
Hi, I'm Dr. Sangeeta. I have a home healthcare services startup. And how is it that this technology, if we want to partner with you, would help us in delivering better value to the patients whom we have? the biggest challenge that we have faced is when we started with building a technology for healthcare, specifically for consumers. It didn't have a buy-in. Because if we ask for a small subscription fee, even that does not have a buy-in. But if we can use your systems to help us deliver and bring in a buy-in, how can we take this forward? That's my question.
Well, your specific operating model, I do not know for me to comment. And I think this is something that we can offline catch up and see if there's a solution to this.
Sir,
Thank you, sir.
excuse me, sir. One last
so-
question, sir. Last question. So this is related to the technology that you have mentioned. The app that you have created is basically the patient-centric and data collection system, which data. So whereas, do you have any plans to expand the app to implement AR, VR, basically augmented reality and virtual reality? So how does that helpful in this healthcare?
So right now, the app that I showed you is a back-end app that helps the call center agent counsel the patient, right? I mean, AR is more consumer-facing. What I've shown you are those that we've been able to bring out at least in the pilot phase. There are 26 more ideas which are either in the early conceptualization stage or in the piloting stage. And that's the nature of this evolution, right? I mean, you try out in small scale, whatever works, you scale up. And then we don't try a lot of things alone. We try with other partners, IT partners. There are 3 healthcare IT organizations that we are either in talks with or have already signed MOU. The EMR solution is something that we have already gotten into a partnership with.
So those companies who offers AR, VR solution, so the partnership is open.
Yeah, so partnership is open for,
Yeah.
like I said, any of those 3 collaboration areas. What it is a matter of understanding where what fits in and what kind of value does it bring.
Okay. Thank you,
Again,
sir.
we can catch
Yeah.
offline. No problem.
Yep.
Thank you so much, sir. I would request Dr. Ganapathy to present the moment.
Thank you.